Hi guys, welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one-on-one sessions, Q banks, question analysis, and more to assist nurses and nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. I have maintained a 99% pass rate with all of my review courses and a 100% pass rate with one-on-one sessions. Now, y'all know I always like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any other questions that you see here I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of the videos that I do where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. Question number 1 states, a 60-year-old patient with a history of diabetes and hyperlipidemia has a blood pressure of 150/92 today. He is being evaluated for antihypertensive treatment. Based on these findings, what is the recommended first-line medication class for this patient? Is it A, you want to continue to monitor the patient is healthy and no treatment is warranted? B, thiazides? C, calcium channel blockers? Or D, ACE inhibitors? Take a moment and tell me what you got in the comments, you guys. All right, y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, based on these findings, what is the recommended first-line medication class for this patient? All right, so we're looking for treatments, right? And here, I always tell y'all, first off, if they're asking you for a treatment, then you need to run it back and see if they provided you with the diagnosis. And they have, because they mentioned antihypertensive treatments, all right? So we're looking for blood pressure management, right? So you still want to run it back and navigate through everything that's provided so that you can determine exactly how you should move through this, right? So, I tell you, when you're looking at those assessment findings, you want to look at the things that consider their age, their gender, their ethnicity, if they are included in those, and then if they have any allergies and past medical history. So here, this is a 60-year-old patient, and they it doesn't tell the gender or ethnicity. So just keep their age and see if that's something that you need to pay attention to for the treatment option. It doesn't include any allergies, but it does tell us that the patient is diabetic and has hyperlipidemia, right? Also, a key in the stem of the question is it's asking for the first line medication. So, considering that they have a history of diabetes, we know we want to do renal protective measures. So, the first line therapy, according to ACC and AHA guidelines, we go with an ACE inhibitor, right? So, D would be your best answer. All right, question number 2. A 55-year-old patient diagnosed with hypertension but does not have any other risk factors. Which of the following should be the first line treatment? Is it A, initiate chlorothalidone, B, initiate lisinopril, C, initiate amlodipine, or D, initiate losartan? Take a moment and tell me what you got in the comments, you guys. So here the stem of the question states, which of the following should be the first line treatment? So again, if they're asking you for treatment, you want to run it back and look for if they have provided you with a diagnosis. And if they have not, you want to run it back a step further and look for those assessment findings, right? So here they're telling us that the patient has been diagnosed with hypertension, but this patient does not have any other risk factors, right? So what you want to think of is, what is the first line therapy for hypertension? So that's all this question is saying. And I wanted to do something like this because sometimes, and when I do question analysis sessions with reviewers and we're working through these questions, sometimes the question can ask you something so simple, but you think because of what type of exam it is, they're saying something much deeper. And sometimes they word it so crazy that it sounds like it's deeper than what it is. So I try to do something like that just to give you an idea. But basically, all this is asking you is, if somebody has hypertension, what is the first line therapy, right? No other risk factors. So what is your direct first line therapy? So I always tell y'all, think of the starting four, right? our thiazides, our ACEs, our ARBs, and our calcium channel blockers, with thiazides being the captain, right? They're the top of the top. So even though we have starting four, who leads that starting four? Our thiazides, unless it's something that we rule out for that, right? So they don't have any risk factors. So there's no reason to rule out the thiazides. So that's your best answer. You want to start with A, initiate chlorothalidone, as it's a thiazide, right? All right. And lastly, question number 3, a 58-year-old patient with a history of hypertension and diabetes presents with a blood pressure of 145/90. According to the ASCC and AHA guidelines, what is the recommended target blood pressure for this patient? Is it A, less than 140/90? Is it B, less than 135/80? Is it C, less than 120/80? Or is it D, less than 130/80? Take a moment and tell me what you got in the comments, you guys. All right, so lastly, stem of the question here states, according to the ACC and AHA guidelines, what is the recommended target blood pressure for this patient? So this stem is telling you everything. We're looking for the target blood pressure, right? And we're following ACC and AHA guidelines. That's all we need to know. So let's see what's going on. We're going to run it back and look at how this person is presenting. It's a 58-year-old patient. They have the history of hypertension and they're diabetic, and their blood pressure is 145/90. Now, one thing I want you to remember, you know how I always tell y'all, when y'all approach hypertension based off of these ACC and AHA guidelines, I want you in simplest form to look at when to treat and then how to treat, right? So this is asking you when, right? So remember I tell you about your 120s, your 120/80s, your 130/80 to that 89, and then your 140/90, right? I'll tell you about all of those stages. Remember, if they have comorbidities, we do not want them to exceed that 130/80 range, right? Well, this patient has comorbidities, right? They have a history of diabetes, right? So we want theirs to be D, less than 130/80. That's that goal range, that targeted range for this particular population, based off of how this patient presents in their history, right? According to ACC and AHA guidelines. So when you're working through it, remember, consider when we treat, then worry about how to treat them, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. If you need additional help with hypertension, I'm adding my hypertension video in the description as well so that you can look at. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email at the nursing studio, the number 1 at gmail.com. Now, the things that I do offer are my review book. You can get it in an ebook or paperback option. Both of those are linked in the bio of my channel. If you like to study independently, the self-paced review is linked in the bio of this channel. If you need to complete some practice questions to gauge and test your knowledge, all of my QBank options are linked in the bio of this channel. If you like to study like this, I do have many practice quizzes in there as well, where you do the questions and then I do the video rationales like this to talk you through how to approach those and answer those questions. And then lastly, y'all know, if you want to book a one-on-one session, I always say reach out by calling, texting, or email so that I can gauge what you truly need to make sure that we book the appropriate session for your learning needs and goals for testing, okay? All right, y'all. Y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.